Welcome back, everybody, to Leading Experts. I'm your host, Grayson Foster. If you're just tuning into the show, my guests today are two of the top cosmetic and restorative dentists in Plantation, Florida, and they just happen to be father and son, Drs. Marc and Eli Schwartz. For over 100 years, dentistry has been a family tradition for the Schwartz family, and we've been talking about implant dentistry on today's show. Something I love on your website is you say a continuing tradition of changing lives through dentistry. That's great.
Well, you know, when you go back in the history of our family, the focus has always been to help people achieve their goals.
Right.
And to let them feel better by having a confident smile. You know, it's been shown that people with a nice smile are more confident and are more successful. As a matter of fact, a lot of people remember the Extreme Makeover show.
Right.
And what they found, the producers, that was a complete surprise, by the way, that after they had all that cosmetic surgery done, that the thing that made the difference in the show was the smile.
Yeah.
If the smile wasn't nice, everything else didn't matter. And that's what it is. The glow of people who come out with a confident smile just feel better about themselves, and it's important for us to help them achieve that goal.
Yeah. Now, something else, you have just moved into a brand new state-of-the-art office. So tell me about your office a little bit.
Well, we've been in our office for a little while now. It's a beautiful place. I think it gives people the feel of the type of treatment that they should expect.
Right.
It's a new office, it's a clean office, everybody's friendly, and that's what we want our patients to get from where we're located now.
Right. It's very important. I know my dentist is here in California, obviously, otherwise I'd go to you guys in Florida. But when I walk into his office, it feels like I'm going into a spa. And it's like, okay, this is really comfortable, this is really relaxing, and from the pictures on your website and the pictures that we've been showing during the show, it's really beautiful.
Well, I guess we feel like there's no reason people shouldn't enjoy going to the dentist like they enjoy going anywhere else. They shouldn't not want to go for any reason.
You know, people don't like going to the dentist for various reasons,
Right.
or sometimes a history of a bad experience.
Yeah.
And the best thing that we can accomplish is when people leave, they go, wow, it doesn't bother me anymore.
Yeah.
I don't mind going. As a matter of fact, I actually like it here.
Yeah.
And if that's your goal, which is ours,
Right.
the dentistry is important.
Yeah.
But you have to first have people confident and comfortable to allow us to do the dentistry.
Exactly. All right, since we're talking about implants, how can implants help people who are denture wearers? Because this is a big issue, because dentures are flopping around people's mouths and you don't get to eat as well, and it affects your quality of life. So how does an implant help a denture wearer?
I think implants, okay, for people that wear dentures, is probably the greatest thing that's ever happened.
Yeah.
Okay, it's unfortunate that when somebody gets to the point they have to wear a denture, and then the experience over time hasn't been that great.
No.
They're not always so comfortable, they move around, food gets trapped in them. So implant retained dentures, they don't move around. Okay, you have less material in your mouth. So really, for anybody who has to wear a denture, implants is probably the greatest improvement that's ever come around.
You know, I have to say something that in 1984, when I first started placing implants, my instructor was one of the leaders in the development of implant dentistry. Said his goal was to help people who had floppy lower dentures have stability.
Right.
So he just was placing a couple of implants to give that stability, and that's really how things started. Now we can place them on the bottom, we can place them on the top. People can have secure lower dentures, and they can have secure upper dentures without covering the palate.
Right.
And I think we have one of the cases.
You brought with you, is this gentleman Seymour?
Seymour had a denture that covered his whole palate.
Right.
And I said, by the way, you know, we have something that I think can help you now.
Yeah.
Eliminate that so you can taste your food, you don't have all that material in. I said, why don't we try that? And we did. And
he wasn't reluctant or afraid?
Well, you know, I explained the benefits and risks, and there are very few risks. And afterwards, 4 implants were placed and a denture, as you can see. And he looks like he has his own teeth, and he can eat anything.
There's Happy Seymour.
Happy Seymour. I mean, he
People
can eat
are always
anything.
happy after they have it done.
I bet.
I've never seen one person have that done and regret it.
Right.
It's just,
Amazing.
I mean, it's an amazing thing for people that have to wear dentures.
Is there anyone who wouldn't benefit from having implants placed if they're a denture wearer?
No.
No, absolutely
So
not.
that's the easiest question you've asked the
Yeah.
whole time. Really, the thought of being able to wear a denture, it never moves. When you eat, it's stable. So you're able to eat different types of foods. You have more ability to chew. There's no reason anybody that wears a denture shouldn't have it done.
And people shouldn't be afraid or sitting at home watching this and thinking, you know, I'm sure it's scary, I'm sure it's painful, I'm sure it's a long, drawn-out process, but that's not true at all, right?
It's not true. As a matter of fact, implant dentistry, quite frankly, is some of the most comfortable dentistry that's done. A lot of the discomfort people have when they have teeth work done is teeth have nerves and fibers and vessels, and bone doesn't really have sensory nerves. So when we work on it, there's no sensation. So the gums are numbed up a little bit, the implants are placed, and the most common response that we get from patients is, wow, if I knew it was this easy,
Right.
I would have done it years ago.
Right.
People that are at the point of wearing a denture have had a long history of dental treatment. I mean, they're older people. And when they started treatment, things were a little more difficult.
Right.
Okay, so they can't maybe conceive that something could be done that's this easy and virtually painless
Right.
and turn out this well.
Something we haven't touched on either yet is sedation dentistry. For people who are fearful, that option's available, right?
People can have nitrous oxide, they can take some oral medications, and quite frankly, it's available. But the procedures are so easy that after we talk with patients, most patients don't even need it. Sometimes a little nitrous just to take the edge off,
Right.
but it really is a very comfortable procedure.
What have you, well, you've done over 1,000 hours of training in implant technology, and you've been doing this since 1984. Are there any trends that you've noticed with implants, or what have you really noticed over the years?
One of the biggest advances in implant dentistry is that the time period from the start to the finish of treatment has shrunk down tremendously. We can now restore cases in 3 months that used to take 9 months, and sometimes even immediately put in teeth. So that's the biggest factor, because people get tired of waiting too long.
Right.
So the time is the biggest improvement.
Everybody wants everything now, right?
Yeah.
Yeah.
Well, it's a now society.
Yeah, of course. All right, doctors, we're going to take another break. Stay with us, everybody. Leading Experts, we'll be right back.